My name is Dr. James O'Donovan, and in this video my colleague Ella Boyes, a qualified physiotherapist, is going to demonstrate exercises you can do at home to help recover from an ankle sprain. The equipment that you're going to require for this is a towel or resistance band as well as a chair. The video is divided into several sections depending on where you are in your journey for ankle sprain recovery. These first set of exercises are phase 1, in the early days following injury. Now the goal here is to regain movement as soon as pain allows. So this means beginning with gentle stretches and then moving to range of motion exercises once the stretches become tolerable. So let's start off with stretching exercises. Exercise 1 is the resistance band or the towel stretch. To do this exercise, sit comfortably on the floor with your legs extended. Loop a towel or band around the ball of your foot like you can see here. Pull it gently to stretch the calf and hold it for 30 seconds before repeating it 3 times. Exercise 2 is the standing calf stretch. For this exercise, face a wall with your hands at eye level. Place your injured foot behind you with the heel on the ground, toes slightly turned in. Then lean forward until you feel a stretch in your calf. You can hold this for 30 seconds and repeat it 3 times. Exercise 3 is the standing soleus stretch. Stand facing a wall with your knees slightly bent. Place the injured foot behind you and then lean the knees towards the wall, keeping your heel down. You'll feel a stretch at the back of the calf and also in your Achilles. Hold this for 30 seconds and repeat it 3 times. Now, the next phase of recovery is phase 2. This is typically days to weeks after injury, typically when the swelling has improved. Now remember to help reduce swelling in the initial period, so 48 to 72 hours after the injury, you can follow the RICE protocol, which is rest, icing the area for 10 to 15 minutes every 30 minutes, applying compression as well as elevating the affected ankle. Now the goal in this phase is to do range of motion exercises and to mobilize the ankle. So a great set of exercises in this phase are what we call the alphabet. So for this you can sit or lie down. Now the aim is to write the letters of the alphabet in the air with your foot as Ella is demonstrating here. Take your time and don't rush this. Once you've gone through the entire alphabet, do 2 to 3 rounds of this, and you could space this out by doing 1 at breakfast, 1 at lunchtime, and again 1 just before bed. So the next rehab stage is phase 3. This is when you're weight bearing comfortably. Now the goal here is to improve your balance and strengthening. And we're going to cover 4 great exercises for this phase here, all of which involve resisted movement, which will really help building the strength back into the ankle and hopefully make you feel more confident following your injury. So the first exercise in this 3rd phase is resisted dorsiflexion, which Ella is going to demonstrate here. So first place your injured foot under the good foot. Next, pull the toes of your injured foot up towards your face whilst using the good foot for gentle resistance. Don't press too hard at this point, just make sure that there is enough resistance there that you can feel it with the bad foot. Hold this for 5 seconds and repeat it 10 times for a total of 3 sets. Now the next resistance exercise is resisted plantar flexion. Now this is the opposite movement to the one that you've just done. Again, Ella is going to demonstrate this for you here. So first, place your injured foot on top of your good foot. Push down as if pressing a pedal on a car, using the good foot for resistance. Hold this for 5 seconds and repeat it 10 times for a total of 3 sets. Next is resisted inversion. For this, push your feet together, focusing on the inside edge. You can hold it for 5 seconds and again repeat it 10 times for a total of 3 sets. The 4th exercise is resisted eversion. Now for this, cross your ankles and push the outer edges of your feet together. Again, hold it for 5 seconds and repeat it 10 times for a total of 3 sets. Now, the next phase of rehabilitation is the more advanced stage of rehab, and these are balance exercises. Now, these exercises are going to really help the ankle stability and with what we call proprioception. So, for example, if you're going to run again, you need your ankle to be really stable. So if you're running on uneven ground, otherwise there's a risk that it can turn or sprain your ankle again. So the first set of exercises here are heel raises, which Ella is going to demonstrate. For this, you should try standing behind a chair. Next, raise up on the toes of both feet and hold this for 5 seconds, whilst slowly lowering down. In this lowering phase, it's really important not to rush it, so try to take at least 3 seconds on the way down. You can repeat this 10 times for a total of 3 sets. Now, the next set of exercises are single leg heel raises, which we'll demonstrate here. So for this, first stand on the injured leg and try to balance on the foot for 15 seconds. You can repeat this 3 times. And to make it more challenging, you could try doing this with your eyes closed, but this is more advanced, and I'd advise if you were to do this, you have something nearby to manage your balance in case you were to accidentally fall. So the third set of exercises to help with balance are toe raises. For this, rock back on your heels, lifting your toes off the ground. Hold it for 5 seconds and try to repeat it 10 times for a total of 3 sets. Finally, if you've worked your way through this whole program and you're looking for some bonus exercises for additional strengthening or balance, then here are 2 great advanced options for ankle sprain rehab. First are single leg hops. So for this, first lift the good leg and hop on the injured side. You could start with small hops, aiming for 10 hops, and repeat this 3 times around. Finally, there's an option to practice your balance and stability on a wobble board, and I've included a link in the description box of this video where you can purchase one online. And it looks like this. So you can start by balancing with both legs, and then over time you could progress to one leg only. I'd advise that you do this for no more than 5 minutes, and you try to do it 3 times a day. And again, if needed, you should use support. I hope you found this video helpful. If you did, please give it a thumbs up and subscribe to the channel. Finally, please do remember that this has been intended as a general educational guide only. To make sure that these exercises are safe and suitable for you, always seek advice from your own healthcare provider first before attempting them. Thanks for watching, and bye.